Dr. N.S. Datta from Kolkata. Our today's discussion will be on what high blood pressure is and how to prevent it. Generally, everyone would like to have healthy or normal blood pressure. But what exactly is normal blood pressure? Basically, each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessel. This is called blood pressure. That is, the lateral pressure exerted by blood on the walls is called blood pressure. Normally, in a healthy person, it rises and falls throughout the day. But when blood pressure remains high for a longer period of time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle, for example, not having enough regular physical activity, obesity, smoking, high alcohol consumption, and stress. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow as excess fat builds up. Family history of high blood pressure. One or more close family members with hypertension increases a person's risk of developing this condition. Excess salt intake is also known to raise blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney disease. Eating processed and fatty food increase fats throughout the body and make the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further to high blood pressure. Another one, and not the least important one, is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Moving on, hypertension does not have any obvious signs and symptoms. That is why it is known as a silent killer. It puts people at risk for several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis is very important in management of hypertension. Measuring the blood pressure is the only way to know whether the person has high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, buzzing in the ears, fatigue, nausea or vomiting. If person is experiencing some of these symptoms, then one should get their blood pressure checked. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called sphygmomanometer. Blood pressure is recorded in two numbers, systolic and diastolic. Now let's try and understand what do these numbers actually mean. A healthy or normal blood pressure should be lower than 120 by 80 mm of mercury, or it can also read as 120 over 80. Here the upper number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, which means the pressure in the blood vessels when the heart rests between beats. If blood pressure level is more than 140 by 90, then the person is said to have hypertension. If person have BP levels higher than this, then he or she might at risk of developing serious heart diseases. The risk can be prevented and reduced by taking steps towards a healthier lifestyle, such as regular exercise, healthy diet, quitting smoking and reducing regular blood pressure monitoring, stress management, adherence to medicine. If blood pressure is successfully controlled with such lifestyle modifications, then it might avoid delay or reduce the need for medication. So let's take a look at these strategies one by one. Number one is regular exercise or physical activity. Exercise can be a drug-free approach to lowering high blood pressure. Regular physical activity makes person's heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force on the blood vessel wall will decrease and lowers the blood pressure. In other case, as we all are aware, that age and weight gain are the two major risk factors for high blood pressure. So if the blood pressure is a desirable level, then 120 by 80, then exercise can help prevent it from rising as we age. Now let's come to the second point, that is healthy diet. Diet also plays important role in controlling blood pressure. A diet with a high intake of vegetables, fruits and whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension through dietary intervention, can one adopt a dietary pattern such as DASH diet or Mediterranean diet, eating less saturated fat and total fat, getting plenty of potassium, limiting the amount of sodium in the diet and limiting alcohol consumption. DASH stands for Dietary Approaches to Stop Hypertension Diet. Eating a DASH diet, that is rich in whole grains, fruits, vegetables and low-fat dairy products and skims on unsaturated fat and cholesterol, can lower one's blood pressure by up to 11 mm of mercury if he or she is having high blood pressure. Reducing sodium in the diet is another method of lowering blood pressure. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 mm of mercury if you have high blood pressure. To decrease sodium in your diet, you can consider tips like read the food labels. If possible, choose low sodium alternatives of the foods and beverages you normally buy. Eat fewer processed foods. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing, so you can eat natural products. Don't add extra salt. And quit smoking. Stopping smoking helps your blood pressure return to normal. Quitting smoking can effectively reduce your risk of disease and improve your overall health. Now we come to regular blood pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for patients to visit doctors and check up their blood pressure. Hence, I advise patients for self-monitoring of their BP levels. Self-monitoring helps the person to measure BP at different times of the day and over a longer period of time. It also assists doctor to get a more complete picture of the person's blood pressure readings at different times. Further helps us in better prediction of cardiovascular morbidity and mortality rather than single blood pressure measure that occur during a clinical visit. Stress management. In this previous heading of measuring blood pressure, nowadays there is ample choice of the ambulatory blood pressure monitoring, and this is a very marked instrument in measuring a patient's blood pressure throughout the day. Now we come to stress management. By learning how to relax and manage stress can improve emotional and physical health and lowers high blood pressure. Stress management techniques include exercising, listening to music, focusing on something calm or peaceful, and meditating. Adherence to medicine. A medicine to lower blood pressure may be recommended by a doctor. If your blood pressure is constantly high, usually or above 140/90, adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adapting healthy lifestyle can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Thank you.